Hey, everybody.
Hey.
Hi.
How are you?
Good. How are you guys?
There we go.
Oh, Sonia's audio is still connecting. Nancy, can you hear us? And Jennifer, can you? Oh, yeah. Okay. This is. They're both on.
Hi, Monique.
Hey, there you are.
I can't figure out how to get my sound to work on my computer at work, but we're on Sonia's phone.
Okay, that's fine.
The struggles are real, Monique. So much.
Oh, I gotta make a note of who's on phones. And I don't think Nancy. Let's see. Who's calling in from 2990?
2990.
Phone.
I have one.
Monique?
Yeah.
Hey,
Who's
Monique,
that?
it's Patty.
Patty. Okay, cool.
It's
Thanks.
Patty at 2990.
Okay, cool.
Monique, can you hear me?
Yes. Who's that?
It's Ayla. I can't get my video to work for some
Oh,
reason,
that's
but
fine.
just
No
want to
worries.
make sure you can hear me okay.
Yeah. Cool. And Louisa, do you want to just test sound real quick?
Hi.
Cool. Awesome. Carol, you want to test sound real quick?
There I am.
There you go. Okay, and then who called in from 3320?
You try it. I don't know. Oh.
And is that Ryan Lockwood Ryan? Or Ryan Chase Ryan?
No, it's Lockwood.
Okay, that's what I thought. And Nancy, we can't hear you. I just want to make sure. In case you want to call in from a phone. Okay, cool. I know we're expecting a bunch more people, but then I had that super tight agenda, so I'm just gonna share my screen for this first bit. Let's see, there we go. Can you guys all see a Google Doc?
Mhm.
Okay, awesome. So yeah, I just figured, let's see if I can open this. I have a folder, so the link that's in this agenda just goes to this resilience folder. So I'm putting all minutes and agendas in here. The teams, which is an evolving document at this point, as people want to shift around and things. So that's in there. And then I have some starter. Ayla has one for medical and health, like a notes kind of document, going to just allow like anybody who's on that smaller team to just go in and record notes in between meetings. And then I've done the same kind of thing for volunteer and communication. If anybody else wants those for like the smaller teams, just let me know. I can make one for each one if that's helpful. Just so people don't have to be scrambling around before the call to meet with everybody. And for my teams, like I'll definitely, I know in everybody's case, you may not have all met in your small groups, and that's totally okay. But try to over the course of the next week. At this point, everybody has a lead and then smaller teammates as part of that small group. So, and just for the interest of time, we'll just try to keep it to leads reporting out on this call. So let's take a few minutes and just go around and do introductions. I'm gonna stop sharing the screen. So let's see, I'm just gonna call out to people and if you could just say name and kind of what you're representing and if you know the team you're on. So I'll just start with Ted.
Yeah, Ted Uncles, Bradford Select Board Chair. I think I'm on the Communications Task Force as well as the Town State Government Task Force.
Cool, thanks Ted. Sonia and Jen. Sonia and Jen, can you introduce yourselves?
Jennifer Rivers, and I'm the treasurer for the town.
Sonia Macklem, I'm the town clerk, and Crystal.
The dog. Angela and Brian.
I guess I'm on the business and finance resource
Cool. Thank you.
and concerned
Angela,
citizen.
Yeah. Fair enough. Justina.
Bradford Citizen, and I believe I'm on the volunteer committee.
Cool. Thanks, Justina. Oh yeah, and if you're not on a thing and you want to be on a thing, let me know. Otherwise, like, just come to the calls. And feel free to email me and stuff like that. Ayla.
Ayla Priestley from Little Rivers. I'm here with Ashley Buchanan as well. We're part of the health, mental health, and pharmacy.
Cool. And Ashleen's doing food as well. Yeah, cool. And I think I have her on volunteer. She's all over the place. Carol. Yeah.
Carol Freeman. I'm doing senior citizens.
Awesome. Thank you. Erin.
Erin Odell. I'm on the volunteer as well as the business and finance.
Yeah. Cool. Thank you. Sarah Copeland-Hansis.
Hi, Sarah Copeland-Hansis here, state and local government coordination.
Cool. Thank you. Oh, there's Ashleen. Ashleen, did you want to say anything else? Introduce yourself. Sorry.
That's okay. My name's Ashleen Buchanan, and I'm the program and grants coordinator at Little Rivers Healthcare. And like you guys said, I'm on a couple other groups.
Cool. Danielle Cordy.
Yeah, so I'm on the communication group, and I'm actually subbing in for Bruce Williams today, who's the one who's doing the school and library and youth. So
cool. Thanks, Danielle. And I have you on communications too, and we haven't got to touch base, but I want to do that.
yeah, nope, that's fine.
Cool. Gail.
Hi, everybody. I'm Gail. I'm on the library, on the Library Youth School Committee.
Oh, thank you. I have Jennifer, but I think it's just Jennifer's computer, maybe.
Yes.
Okay. All right. Just making sure. Louisa.
She has Jennifer's computer. But...
Hi, I'm Louisa. I'm a property manager with Down Street Housing. We do Colonial Village and Waits River Housing, and I'm on the housing committee.
Awesome. Thanks, Louisa. Nancy.
Nancy Jones, Bradford Conservation Commission and the Mentoring Project.
Cool. Thanks, Nancy.
And I think I'm on the Youth Education Committee.
Cool. Thank you. And Nancy, are you also on your computer, or is there another Nancy? Make sure. Okay, I'll just assume that's the same Nancy. Ryan?
Ryan Lockwood. I'm on the vice chair of the Bradford Select Board. I'm heading up the state and local government, and I am on the food group as well.
Cool, thanks, Ryan. Linda Anderson? Linda, I think you might be muted.
Can you hear me now?
Yep.
Okay. So Linda Anderson with Capstone Community Action, and I think it was energy and housing.
Yeah, cool. Thank you. Awesome. Marianne?
Oh, hi. Can you hear me?
Yeah.
All right. This is my first Zoom meeting. Thank you for your patience with me. Marianne Barnett here from the Council on Aging, working with the senior citizens group of this gathering.
Awesome. Thank you.
Thank you.
Patty?
Ah!
There we go. Patty? I saw you on mute.
Oh, can
Yep,
you
I
hear me now?
Yep.
Oh, sorry. Patty Clark from the Wells River Savings Bank, and I am on the business and financial resources.
Awesome. Thank you. Gary?
Gary Moore, Bradford Emergency Management Director and Chair of the Public Safety Commission.
Cool. Thanks, Gary. Sydney?
Yeah, Sydney McIntyre, Dartmouth Hitchcock, and Willing Hands, and I'm on the Food Access Committee.
Awesome. Thank you. Ramsey?
Hi, I'm Ramsey Papp, Capstone Community Action. I'm a housing counselor, usually serving the Bradford area. Still serving the Bradford area, just not in Bradford.
Great. Thank you. Let's see. The tiles all moved around on me. Sarah? Pushy?
Sarah Pushy from the Bradford Business Association on the business resource.
Cool. Thank you. And I think your mic might either be a little far away or you might be trying to whisper. Okay. Who else is in here? Marvin, I think, is called in. And if you're on a cell phone, you can press the mute button, but if you're on a dial-up phone, it's *6 to mute and unmute.
*6.
There we go.
So you didn't hear what I said? No?
Nope, but we can now.
Okay. Marvin Harrison, I'm late to the game, just back from the West Coast and not on any committees at this point, but ready to serve.
Cool. Thanks, Marvin. And then okay. Who is 0525 at the end of your phone number? And you're muted if you're trying to talk. Okay. Just one more time. 0525. It's a 291 number. And if you're on a dial-up phone, it's *6 to unmute. Okay, I'm gonna skip over 4590.
Did you get me, Monique Carroll Taylor?
Nope, but I can now. And are you with Vicky again this time?
No, I'm by myself this time.
Okay, awesome.
So I'm on the churches and I'm on the emergency management.
Cool, thank you. Okay, so, and we won't do introductions each time. I figured there's enough newer people on the call. We should do that. So we'll just jump into emergency management. Gary, could you just give an update, any needs, next steps? And we're gonna try to keep it to just like 3 minutes each if we can do it.
But everybody that I'm hearing from, I'm encouraging them to go to the site you set up so we can coordinate the volunteers.
Cool.
I keep getting people calling several times a day. With the latest restrictions put on by the governor, I'm sure we're going to get more requests. But the answer to everything is just try to stay cool, try to stay in as much as possible. And when you have to go out, avoid your contact with people as much as you can. In the meantime, we'll all work together and we'll get through this.
Awesome. Thanks, Gary. Let's see. Oh, I guess that's me. Communications. So and anybody can see the notes that I put in there, and I have not had a chance to touch base with the rest of the team, Ted and Gary and Danielle. But the biggest things for me are just planning on asking the select board if it's possible to do a paper mailing to reach people who do not have internet access. And also kind of working with the volunteer team. There's some people who have an interest in doing working on the phone tree aspect that we talked about last time. So if anybody wants to help with that, let me know. We did get a page on the town website for COVID alerts. And so that's in place, and there's an alert link on the front page, but I have not put anything into it. I'm hoping by end of day to do that. Otherwise, posts are going out on the listserv, Front Porch Forum, the Facebook group, and the Facebook page with anything. If you guys have, I know Sarah and Gary have just been forwarding me stuff to put on those channels. Totally feel free to do that if it's something that you don't feel comfortable trying to broadcast everywhere. And then So Danielle is getting additional guidance on what the supervisory / schools would like to be posted on the different channels. And she's just kind of being aware not to duplicate and overshare that. And then reported out that West Newbury has a call chain in effect to allow people to contact their buddy, and then a shopper's call to assign items. In Bradford, it's slightly different, but I'll do that when we get to the volunteer piece. Managing too many windows. And there's volunteer pieces now. So working with different town and state efforts for mutual aid. Right now in the town of Bradford, we have 8, kind of breaking it up into different teams, kind of like this. So there's 8 leads of teams. They'll be assigned 10 or so volunteers at a time. I have 3 floating leads who aren't available. They don't feel comfortable leading a team completely, but they want to be able to help assign tasks. We're meeting on Friday afternoon. Then I have Justina. She's on the call. And the 2 of us are basically going to, once we have the needs survey out, we're going to take the form entries and put them into a support, kind of a help desk system. And we'll basically take leads can go in and kind of claim a ticket. They'll have an item where it's somebody needs help. They can go and see what that is and then claim it and then assign it to one of their volunteers. We have had some informal volunteer stuff going on already. I had somebody reach out that needed groceries right away. And one of our volunteers stepped up and was actually turned out to be their neighbor. So went and got them groceries. So Dwayna Covey is volunteered to do, along with many others, to courier from here to DHMC, Upper Valley. John Hunt and Lisa Williams are picking up sewn masks at Bliss Village Store Tuesdays and Thursday mornings to bring those to the hospital. I do know that Little Rivers needs masks, Grafton County Jail needs masks. There's lots of other, so as more people are asking to make masks, trying to tell them those other needs. And Elizabeth Toll is going to step up to start a peer-to-peer phone network support system with people who just need somebody to talk to through this. Working on a volunteer waiver and training protocol by end of this week. And then just need Ted's approval for the needs survey. And yeah, that's it. Town, state government, Ryan?
Yeah, the select board will be meeting tomorrow night and trying out Zoom as well for the first time. And I haven't got a chance to connect with the rest of the group for updates. I didn't know if Sarah had any state updates that she could share.
Do I do that, Sarah?
I definitely do. So there's 2 bills that are expected to pass the House today, starting at 1 o'clock. If you're bored and curious to hear floor proceedings, you can jump on VPR and listen to the live stream of the floor proceedings. There's going to be 2 separate bills. One of them is sort of healthcare and unemployment insurance access issues. So top level there is that if people are uninsured and they would like to get insurance, they can go to Vermont Health Connect right now, and they're streamlining a lot of that application process so that there aren't as many hurdles for financial verification, et cetera. This is a good time to make sure you have health insurance. So if you know of folks who are uninsured, they should be able to go on and get insurance despite the fact that this is not open enrollment period. With respect to unemployment insurance, the Department of Labor will be suspending the requirement to be looking for a job during this time, because obviously everybody's shutting down. And so unemployment insurance application office hours are being extended to Saturdays as well. And I can get some of that detail out and refreshed out there if it's been a few days since you have had a chance to see it. And then the other bill that's going to be worked on this afternoon is the revisions to open meeting law to allow any boards or annual meetings or local entities to meet either telephonically or as we are in a Zoom or Skype type setting. The requirement to notice those meetings is still going to be the same as it always has been. And it's really important that local boards make sure that they go a little extra to make sure that it's clear how people can participate or listen in to those meetings. Because there's a lot of uncertainty right now, and people need to feel reassurance about that. The other aspects of the government operations bill, there's a few sort of random little tweaks to make sure that any municipal permits or license or anything like that someone might need to renew during this time, we're allowing the municipality to extend those to 90 days after the emergency is called off, so that people aren't having to scramble to get into their municipal body to do those renewals. And then a few other little tweaks to some other boards that need to meet. The Fish and Wildlife Board has to have under current law a series of open meetings to set the deer herd culling objectives, etc. And so they would typically have to have those in person, and we're giving them express permission to do that remotely. And then one other aspect in that government operations bill is, as many of you have heard, regulated utilities are being asked to suspend any disconnect by order of the governor, and this bill that's passing today would extend that to public sewer and water systems, so that you can't have your sewer or water shut off during this crisis due to lack of payment. Obviously, it can still be shut off if necessary for repairs and maintenance and all that sort of thing. So I think that's a quick update on what is going on in that legislation.
Well, thanks, Sarah. Okay, and then first I skipped over Kate Beaton. Kate, did you want to say hi? I think I missed you in introductions.
That's okay. I hopped on a couple minutes late. So.
Okay.
I'm Kate Beaton. I am the MTSS coordinator. social emotional learning for Orangey Supervisory Union.
Cool, thank you. Okay, so food access, Ashleen.
Hi, can everyone hear me?
Yes.
Okay, so food access, as far as what I know from a Little River standpoint, is that we are working with our care coordinators and Willing Hands to get food from the Norwich area. So Willing Hands is delivering, well, sorry, I'll step back. Stagecoach is picking up 150 pounds of food from Willing Hands and bringing it to our Bradford clinic, where our care coordinators are then going and distributing that to our patients for now. But we are also trying to coordinate with local food shelves to see what they want their procedure to be for people to come get food from them. So what we've heard so far is that at the Bradford food shelf, they're actually putting together boxes. Our care coordinator, Caitlin, reached out to them, and she said that they're creating boxes that they would like people to pick up. So they're not shopping in there at this time. They're not going through, they're just picking up the box that's been pre-made, and that's what they have available right now to try and reduce foot traffic. And that's kind of the only update I have on food right now.
Cool, thanks, Ashleen. Ayla, medical? Well, medical, mental, pharmacy, etc.
Yeah, I have a few updates. So Little Rivers, I posted a notice. We just closed our East Corinth clinic yesterday for public access. We're diverting our patients towards Bradford or Wells River. So still doing services, but no longer going to be open to the public out there for a bit. We're asking all patients to call ahead of time to be triaged before coming to the clinic. And we are triaging them before they enter the clinic as well. Trying to reduce foot traffic in here as well. So we're doing telehealth visits or phone visits primarily, but we can see urgent need patients. Continuing to accept new patients. And where we're at with our swabbing right now is we're still prioritizing per recommendation of the CDC and Department of Health. Really vulnerable populations, healthcare providers with symptoms, and any patients that are questionably need to be hospitalized. So we're hoping our stock increases here shortly and we'll be able to do more kind of more public swabbing, but for now it's pretty limited. As far as, I'm not sure, is Gretchen Pembroke on the line?
I don't believe she is, but okay. Clara Martin Center at this time they are still taking care of their current patients, but they're trying to do all of the counseling and mental health work on the phone, just like we are at Little Rivers. They are also taking on new patients still, but they're trying to do patient assessments on the phone as well. So at their Bradford clinic, at least, there is very little open office hours. They do have an emergency time. I don't know what that time is specifically, but they are keeping those emergency hours for people to access. Also, Ayla, should we mention that all of our clinics are locked, except you can use the voice system?
Yeah, so all the clinic doors are locked right now. There is a camera and a voice system that connects to the front desk, and that's so we can obviously limit the amount of people walking into the clinic, but we can triage them if they show up at the door prior to coming in. So I should note too that we're right now in communication with Dartmouth and Cottage Hospital in discussions about sharing resources, staffing, and all of that sort of thing. So it's a hour by hour evolving plan, but we'll continue to keep everybody updated.
Anila, do you know any more about Kate Williams's notes?
Yeah, there's a little bit here. So Kate Williams from Averte is doing some focus on elder resources. I know she had mentioned that she's looking into starting a hotline for some of the elders that are a little bit more isolated in the community. Certainly trying to address and head out the caregiver burnout and shortness of staffing in some of these home facilities, as well as the chronic care facilities. And then specifically for them addressing some of the PPE issues. So I'm not sure where she's at with those topics, but she listed them as things that are being addressed.
Okay, great. I'm going to connect her, Carol, with the senior team as well. And I'm thinking about expanding senior team / people with like differing abilities, because somebody had asked about like Upper Valley Services is closed right now. So making sure that people with disabilities and things like that are also being kept an eye on. Okay, let's do business and financial. Erin? Erin, Odell. Oh, we can't hear you.
Okay, I think I got it now.
Yep.
Okay, awesome. Sometimes I lose the mouse on here, so anyhow. We have not met as a small group, but one thing that Marvin did email was asking if there was a list of current businesses in our chamber towns that are open, and if so, what's their capacity and what are they doing? I didn't know if that might be a project that our task force might work on. Kind of question mark.
Yeah.
Other than that, the other part was the revolving loan fund, which we're just discussing the emergency clause and trying to decide if that'd be appropriate to bring to the select board. That's about it.
Cool, thanks, Erin. And I know Ryan also emailed, Ryan Chase emailed an update just that he couldn't make this call. Valley Floors is being affected by the stay in place type order for today. So he was busy with that, but they are going to stay open for like pickup, delivery, and essential kind of management is going to keep working from home. Carol for support for seniors. Carol Freeman.
Okay. We haven't met as a small group yet, but there's some things that I do know. Vicki at the Senior Center is adding clients to Meals on Wheels. So if there is a need, while the center's closed, she's also taking calls and trying to help people with sort of the normal things that she would be helping with, equipment, that kind of stuff. So she is available by phone. The meals are being delivered on 2 days, Mondays and Wednesdays, but they can be either 4, 5, or 7 days with frozen meals filling in for the days they're not delivered. At Margaret Pratt, they've been really working hard with the safety protocols and making sure that the residents there are all safe. They've set up a portal for communication with families for the seniors. They have done some hiring. That may be an opportunity for people who are looking for work, but right now there are no openings. And they have 2 new clients moving in the next 2 weeks, but then they're full except for 1 bed in the memory care unit for a male. And that's about all that I have so far, but I will connect with our group.
Cool. And I know since Marianne is new to the group, Marianne, was there anything that you wanted to report out from the Council on Aging?
Hi. Yeah, so I work with people 60 and older who are most often, I work with many people who are on long-term care programs in their homes or get help with homemaking and stuff from the visiting nurses. The visiting nurses are scaling back a lot of their services just to really essential needs, obviously critical care for their nurses. And for a lot of the people that I work with, it's just going to be they're calling it shop and drop. They're not doing housekeeping or that type of laundry for unless people have severe incontinent needs. So I'm checking in with my people weekly just to see what their needs are. People seem okay right now, but I do have concerns about food availability and shopping for people to get their food safely as things continue. And certainly they're accessing the home delivered meals through Vicky, those who are attending the adult day. We're like everybody else, we're just working remotely on the phone and trying to contact people that way.
Awesome. And there was a question, Carol and I were going back and forth, is whether we needed somebody from the VNA on these calls. Do you more or less keep in touch with them and you could report out, or do you think that would be helpful to get somebody specifically from VNA?
Yeah, it's a little hard because they don't really have one person that I know of. I mean, I don't work intimately with their nurses. I do work with another one of their case managers, but as far as who they have specifically designated to this area, I don't know. I can certainly, I think that's the update right now, and yeah, if there's more, I can let you know.
Sure. Yeah. Thank you.
Mm-hmm.
Okay, schools, Danielle. Nope, you're muted.
Okay.
There you go.
So I did have an opportunity to speak with Bruce this morning. He ended up double booked for today. So his update was mostly about the food services being provided to students and the kids. At this point, it's running very, very smoothly. The food is being provided and meals are being provided for almost 500 students. It's roughly above or below that every day, which is actually 1,000 meals because each meal delivery contains 2 meals. It's lunch and breakfast. And it's being run out of Bradford right now, and both Bradford and Newbury Elementary School have curbside pickup, where if you can't make the bus stop location, you can just pick up directly at the school. And they're doing it responsibly. Obviously, they're maintaining distance and making sure that everybody has what they need. So that's been going really well. There is talk that if they need to, with the new announcements with the governor, they can sort of wind it down to 3 days and be able to sort of supplement in if they need to provide additional meals, but on a less frequent basis. And then there's also talk about being just able to ramp it up and be able to do either a lower amount of deliveries, but more meals, and be able to cover the students for actually 7 days, which would be amazing. And this program is available for all students, all the way up to 18-year-olds. So, and it is not at all based on income or free and reduced. It is any student who is participating in school in the district. They are also, providing meals for some of the younger students who have yet to come into the system. So that's working pretty well. So they're happy with how that's going. They are waiting for more guidance from the governor's statements today as to what effect that will have on food delivery, if any. They're anticipating that they will be able to continue, but they're preparing in case they have to do something different. And then as far as student and parent communications, the teachers have been just amazing. As far as most of the parents that I'm hearing from are getting lots of communication, sometimes too much communication from teachers and staff, and making sure that they have access to what they need. So that's been going pretty well. Students themselves are being given email communications from teachers as far as what their workload is. Some of them are able to do Zoom classrooms like we're doing right now, and they're being provided with, that type of meet every day. Sometimes it's, once a week. Those types of things are definitely starting to fill the pipeline. More teachers are definitely getting more comfortable with that, which is great. So overall, that's going really well. Also, just, so everybody knows, BMU, Blue Mountain, is also doing meals coverage through their school, and also has ability for people to pick up in alternative locations, as well as Waits River. Excuse me. But Bradford is the hub for Newbury community and Bradford community. So that's pretty much the school piece.
Awesome, thank you. Gail, did you have anything you wanted to add from the library?
Hi, everybody. So I haven't heard too much from the teachers as far as needing anything from me, and it sounds like they've, I mean, I'm in communication with the teachers, and they are doing an awesome job. I'm really impressed with how everybody stepped up and really getting creative with the online format. It's been awesome, I think, for the kids. I've been doing a lot of virtual programming. The story hour thing online has been really popular. Kids are sending me artwork, and it's just been really kind of fun. And I just got off another meeting with the Department of Libraries on all kinds of adult programming that we'll be able to offer, to the community as well. So, here, if anybody needs anything, the doors are shut, but we're getting a lot of other stuff done, and we're really ramping up our platforms, all our services online. Unless somebody needs.
Thank you. That's where the dog is coming from, but I don't know if I can tell.
That's my puppy. I'll mute my mic. Sorry.
No worries. Carol Taylor on churches.
The Methodist Church is sending out emails to their people and sending out services. I'm told that the Catholic Church is totally shut down. They're doing nothing. Excuse me. The Congregational Church has a phone chain going where we're contacting all of the members once a week to see if they need anything or, need any assistance of any sort. So if anybody has a name that needs to be contacted daily, we certainly could add it to our list. The Congregational Church also is donating money to the food shelf to help keep that stocked. And they've helped a couple people with fuel assistance. I haven't heard anything from the Evangelical Church. I've tried to reach out to him twice, and I don't have an answer from him, so I don't know what's going on with that church. But the other churches seem to be okay with what's going on. So that's all I have.
Well, thanks, Carol. So I don't know if Marcy was able to join. I'll just give. Okay. So I think Linda and Ramsey, I guess if you could just use the time, I know you're new to the call too, so are there any updates from Capstone, anything in particular you're seeing in Bradford, any needs that you have that we could help with? Yeah.
So I'll talk a little bit about how we're providing service, and then Ramsey, maybe you can jump in with if we've seen anything additional. We are still providing our fuel assistance and housing assistance programs. We're just doing it by phone. So that's not a huge change for folks in the Bradford area. We are asking people to call and leave a message because we are now down to one person in the office. Everybody else is working from home. So if people leave a message, we try to get back to them as quickly as possible. And then the procedures are pretty much the same as they always have been. We provide counseling services, and then paperwork in some circumstances is sent out to them. In other circumstances, we're able to just take their permission verbally by phone and make note of that on our papers. So not a whole lot of changes.
This is Ramsey. We have seen a pretty, I would say, a slowdown in current calls, and I don't know if it's because people are just really freaked out about even getting out. I did just listen for a few minutes to the governor talking today, and somebody asked about the status of evictions and foreclosures, and he said in the next couple days we're going to hear something about addressing that. I don't know what that means exactly, but my concern, and I hope that maybe our grantors will let us adjust things, is that if we wait for however long it takes when people are far behind to be able to help people who are not able to pay their rent, it's going to be too much for us to afford. So I hopefully maybe we'll have some guidance that we can actually do some real prevention at some point that will come through our funders. So hopefully that will be something we can do. We did have a couple different people have called looking for things like somebody, their hot water heater's not working. So I was reaching out to somebody, and that hot water heaters are not something we typically take care of. So I was reaching out to some of your local churches around your area to see if there's anybody knows plumbers that are willing to volunteer their time to go in and check out to see what somebody's problem is, to assess it, and then we would have to try to help them find resources. But it's been a little bit slower than usual. I don't know from landlords' perspectives if they're still trying to rent things out. I know on Craigslist today there's like one apartment available in the Bradford area, so it looks like things are pretty slow at the moment.
Okay. And yeah, I'll keep in touch with you too, as far as like when we have the needs survey and the volunteer network kind of activated, if there's things we can do to specifically like that you can push things like the request for somebody to look at a hot water heater, like that type of stuff, for sure. Okay, and then transportation, Mike can't be on the call, but he said the update was just that the first food was moving from Willing Hands to Little Rivers today, and that it seems like things are generally covered with volunteer support from what he's heard so far. He's also keeping an eye on what the governor is saying throughout the day, and how it's going to affect transportation. He thinks there might be some drop-off interest as far as volunteers and maybe even usage goes, but they're not quite sure. So he's basically just saying they're keeping an eye on the next couple days to see how it goes. But so far they're keeping going with what they can. So I think, and then Ashleen, you had a update on medication.
Yeah, so we heard at least from the Hannaford Pharmacy that volunteers can pick up medications as long as they have the name, the address, and the phone number of the person they're picking up for. And then if it's a controlled substance, they prefer that the patient or that the person whose medication is for, that they call the pharmacy ahead of time. Sorry, there's before the person picks it up, but it's not mandatory. So if someone does show up and it is a controlled substance, they could potentially still pick it up for the patient.
Okay, great, thank you. Yeah, otherwise.
Sorry, Monique, just to piggyback on that real quick, I don't know how many people are aware, but Katie Drugs does also deliver prescriptions around town, and they are continuing to do that. I think it's Monday, Wednesday, Fridays, just so to get the word out there.
Cool. Was there anybody else that wasn't necessarily like a point person that I didn't call on that wants to add anything? And otherwise, any questions that anybody has for anybody? We have 15 minutes. We did great with the point check-in, so good job.
Monique, let me just say real quick, if anybody wants to listen in to the Bradford Select Board meeting tomorrow evening, Danielle Kingsbury can send a link. So either give a call to the town offices or send Danielle an email and she can send you a link. I guess because of bandwidth issues, we're just not going to send that link out to everybody who gets the agenda. But anybody who wants to listen in, that shouldn't be a problem.
Okay, great.
Does anybody know if with the governor's order that restaurants will no longer be doing takeout, or are they still going to be doing it?
Yeah, they're okay to do delivery and takeout. Any of the stuff that he's already said was okay, they're okay to do.
Okay.
This is Kate. I was just wondering if there are similar task forces to this for Corinth, Reigate, Groton.
So I know, so they're all kind of working on it, and I can give you, I'll actually just send a link out to the state spreadsheet that we have that we're working on to try to make sure that every town has a somebody that's doing this kind of stuff. It's kind of different all over the place. I know that West Newbury has something, Corinth has something, Reigate has something, Fairleigh has something, West Fairleigh. I don't know about Newbury, differing from West Newbury. I don't know if Marvin knows that, but
No, I don't. No.
okay. So Keith, and I've tried to reach out to Ben Ilsley like a bunch of times, but so I can definitely share that sheet with you just so you can connect with those other towns if that's helpful.
I think Topsom's also pretty well organized.
Yeah, it's Topsom. Yep. And even Groton is actually getting something together as well. And yeah, I think it's all over the place. Like I've had a lot of those towns reach out asking what they should be doing, but then when I told them what I was doing, they were a little bit overwhelmed. So they're like, "Well, we're not there yet." So I don't know where they're quite at. But
Okay, thank you.
Yeah, Gail, you're muted though.
Yeah, thanks. So I'm wondering, are they all called the Resilience Task Force? If people were to look, into their individual towns, what are they?
A lot of times it's well, and then so I don't know about the ones local to us, but a lot of the ones statewide are referring to them as the mutual aid, like volunteer network, and those are, yeah, we're actually we're working with Vermont Council on Rural Development right now because those groups aren't necessarily working with their emergency management directors and their municipalities. So with VCRD, we're actually working. They're reaching out on our kind of on a grassroots on behalf of the grassroots groups to connect with the emergency management department for the state, Vermont Leagues of Cities and Towns, to formalize this and say, like, these exist, please work with each other. So it's all just taking some time, and it's really messy right now, but I think everybody's trying to pull it together.
Do people, I mean, would we see a value in having some place for people to go to see what stores and restaurants are open and what they have to offer, or does that get complicated because then people feel left out if they're not included, if there was an oversight, or I mean, I don't want to make, I don't want to do something that's going to have unintended consequences, but it just seems like right now it's hit or miss. You have to go to an individual business Facebook page or something like that, or call them to figure out what they're doing.
No, I think it would be good, especially like we could just add that to the COVID update web page for the town website as well, and even just add like surrounding town restaurants just so people know, because like you asked the question about are they still able to be open, there's probably going to be a lot of confusion on whether or not they're still able to serve.
Yeah, and what's happening across the river? I mean, at this point, there's nothing shut down across the river. Is that true?
No, I think New Hampshire actually did most of the stuff that Vermont's been doing like first. I kept seeing it announced, and then Vermont followed suit. So I think, Sarah, unless I'm wrong, I think New Hampshire's pretty similar, but task force wise and mutual aid wise, I can't tell what's going on in New Hampshire. I just saw an article that Gary sent me about Southern New Hampshire organizing, but I can't tell what's going on in Grafton County.
This isn't related to the business side of food and tracking that, but the charitable business world, Willing Hands and Dartmouth Hitchcock, is creating a list of 60 to 70 towns in our area that hopefully I can be able to send you all by the end of the day today, if not definitely tomorrow, that has a point person for each town for people to call if they're having food security issues. We have 14 recipient sites right now through Willing Hands that have actually completely shut down their charitable food networks over safety concerns and other reasons. So we're working with a lot of them to try to figure out what they would need in order to get back up and running, whether it's just volunteers or safety equipment, sanitation stuff. So that's kind of the charitable network in the area for food is definitely being tracked, but I definitely don't know anything about businesses.
Okay. And Marvin and Aaron, so like, I don't know if it makes sense to just try to just cover Bradford right now, or if we can, I know in email we're working with Ruth Ann from the chamber to like figure that out if it makes sense to have the chamber have a page too, and maybe both. But
Yeah, I think maybe we need to have a conversation without, tying up everybody here. But
Yep.
so maybe we should plan to talk later today or something like that.
Okay, cool.
All right.
Gary?
Did you hear what I said about New Hampshire and Governor Sununu
No.
saying he said he did not plan to order a shelter in place the way Vermont did
Okay.
at this time.
Okay, interesting. Thanks, Gary. Anybody
Just
else?
to, so the OESU school counselors have started meeting weekly to kind of look at the social emotional health and needs of the communities. And so any kind of resources for these different coalitions would be really helpful, because I think we're seeing kind of the first emergence of stress and the impact that this has had on families and kiddos. So we're trying to centralize maybe a social services central line, and then can make recommendations and referrals out to various resources based on what we're seeing.
Okay, great. And yeah, just let us know, Kate, and kind of what those, other than what's on the call, like if you need help gathering any of that, just, yeah. I think something like that makes sense too. Once you know that list that you're looking for, you could just email the Bradford Resilience at, I think it's googlegroups.com or whatever, and that'll go to everybody. I think something like that makes sense for everyone. Anybody else have anything?
I just want to thank you, Monique, for everything you've done getting this this whole system up and going. We're incredibly fortunate to have you take the bull by the horn. So thank you.
Yeah, no problem. And thank you everyone's been great. I know it was kind of just a flurry of emails from me, but everybody actually emailed back to the little groups, task forces pretty quickly, and without including everyone and stuff like that. So it was great. So I think, I mean, I'll write up the minutes. I'm recording this. We have that folder. If anybody if everybody wants like a Google Doc for each of the teams, just like you can just put anything you want in there, so everybody can read it at their own on their own time. But then we'll also just report back critical stuff at this. If anybody wants anything in particular, like I said, on the listservs, Facebook, that town webpage for COVID updates, let me know. Otherwise, I mean, so the volunteer network is going to be up soon. I'm hoping probably by the end of the weekend is what I'm really shooting for. I just want to make sure that we're going about it smartly as far as having some like training or at least some guidelines for volunteers, and making sure there's communications between all the volunteers before we start taking needs, things like that. So that's in progress. And if anybody wants to help with that, if anybody wants to share out the form for volunteers and then needs, I'll share it with everybody, but just let me know if anybody's missing too. Like if you know somebody wants to volunteer, but they haven't yet signed up and they're asking you how to. Otherwise, we'll just keep doing the, yeah, thanks, Ashleen. I have been talking to Jeff, so I think he's okay. He's actually got somebody from the Vermont Council of Rural Development who lives in Corinth helping now, so yeah, so it's good. But so we'll just keep doing these weekly calls, and if there needs to be any adjustment to this like structure and anything, just let me know. I'm making this up as I go. So.
Thank you, Monique.
Cool.
I was just adding Jeff Spiegel there because I think Kate had asked for his.
Oh, yeah. Okay, cool.
So that's his contact.
Cool. Awesome. Thanks, everyone.
Thank you. Take care, everybody.
All right.
Thank you. Thank you.
Bye.
Thank you, Monique.
Thank you.
Bye.